Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor. Welcome to my video blog. Today we're going to be talking about anxiety. Anxiety is something that affects a lot of different people and can affect everybody a little bit differently. Now, when anxiety comes to a point where it's taking over your life, where it's causing uncontrollable worrying, obsessive thoughts, recurrent thought patterns, difficulties with sleep, difficulties with digestion, stomach upset. It might be causing nightmares or flashbacks or repeated gestures and behaviors such as repeated hand washing, that kind of thing. It's really time to look into trying to do something to control your anxiety. Now, many people are put on medications for anxiety, which is absolutely necessary in some circumstances. As you may know somebody in your life who's on anxiety medication, it can be quite a godsend for them and can help them to be able to get back to living their everyday life. Now, something to consider though is that some anxiety medications, such as benzodiazepines, are not intended to be used for more than a 2-week period ever. This is something though that I see very often is people will have been on a medication for over 2, 5, 10 years even. And this is something that I really think does need to be looked into further, because if you are having anxiety, there needs to be treatment of the actual cause for your anxiety rather than just band-aiding the problem with a medication. Now, another thing about medications for anxiety is if you've been on a medication before or known someone who has, you may notice that if you miss a dose or you miss a day, that your anxiety comes back full force. This is what we call rebound anxiety, meaning that the anxiety that you're experiencing is actually from a withdrawal of the substance rather than an organic, actual experience of anxiety itself. So I would like to urge people to really look into how they're feeling and really see whether or not this is caused by rebound anxiety or whether or not this is an actual organic anxiety experience that they're having. The difference being that if you wean off a medication slowly and under supervision of your prescribing physician, you will eventually reduce and eliminate any of these anxiety symptoms. If you are to stop your anxiety medication all at once right away, you're going to have a huge rebound effect, and that's going to, in some cases, make patients afraid that they can never go off their medication, but I'd like you to know that that's not the case. Anxiety is something that there are lots of different ways that you can treat anxiety and that you can work to improve your anxiety. The first one is that I like to look at your stress levels. So oftentimes if people have really high levels of cortisol, which is your stress hormone in your body, they're sort of on this go, go, go thing all the time. They're unable to shut their brain off, and as a result, if they become overburdened or overloaded, something goes wrong in their day, for example, they're just unable to cope. The other thing that I see is people with really, really low cortisol levels. It's a similar thing. They're also unable to cope with these stressful situations, and it starts coming out in physical symptoms of anxiety. Palpitations, sleeplessness, restlessness, nightmares, all these sorts of things, heartburn, gastric upset such as diarrhea. These things can all occur when you experience an anxiety attack, and often is really closely related with how you're coping with stress levels in your life. So you can do a salivary cortisol test to see how your stress levels are, or you can just speak with a naturopathic doctor and you can discern the possibility that cortisol or stress is playing a big level in your anxiety in your life. Other things that are really important to note are your neurotransmitters, which are basically the hormones in your body that can either excite your body or dampen the effects of anxiety in your body. So they should sort of be working in concert together to come with an even balance. Now, if some people have an imbalance of these hormones, they can really cause them to experience an overload of anxiety in their life. GABA is a hormone, spelled G-A-B-A. It's a hormone that is mimicked with benzodiazepines, but it's a naturally produced hormone in your body. Some people just have natural deficiency of GABA. This is something that you can look into with your naturopathic doctor for supplementation or dietary changes to help to increase the amount of GABA in your body and reduce anxiety naturally. Other things to consider is that serotonin is another hormone that's actually made in the gut. 90% of your serotonin is made in the gut, which is funny. We think of these neurotransmitters as being brain things, but they're actually gut things sometimes. So if you have a lot of inflammation in the gut, if you have food allergies, food intolerances, if you're experiencing leaky gut or IBS type symptoms where, remember I talked about before, the gut membrane is doing this and it's not tight, it should be looking like this, you may not be producing the right amount of serotonin in your body to begin with. And this is again going to affect that balance of neurotransmitters in the body. Serotonin is closely affected or related to appetite, mood, libido, energy. So if you're experiencing difficulties with those types of symptoms, that's something to consider. Other things to consider are that there are lots of different supplements that you can take, but it's important to really try and treat the underlying cause, as I said before. So if you have a history of a trauma in your life or something that has triggered anxiety attacks to start coming on, it's really important to seek counseling for that. Your naturopathic doctor can provide therapy for you or can always provide counseling resources for you to seek outside of the naturopathic office. But I mean, it's important to realize that you can take all the supplements and eat all the good food in the world, but if you're not treating the underlying cause of your anxiety, then you're really never going to see true benefit. So I hope this was helpful for you. If you are experiencing anxiety or you know someone who is, I would really urge them to seek naturopathic care. It's something that should be discussed more openly and more often, and I really do hope that this video was helpful. For more information, please go to my website at www.hillarybooth.com. You can fill out your contact page there and send me a message. I'd be happy to answer any questions that you may have. Alternately, you can also call the office or book an appointment using my website, and I'd be happy to speak with you in person. Thanks so much for watching. Take care.